How to become better in surgery? This is a core question every surgeon in training asks. And learning how to operate is not a single action, but a progression through several distinct phases that build upon each other, primarily occurring during surgical residency. Here's a breakdown of the key methods, principles, that you should follow to learn how to operate, moving from basic knowledge to independent practice. Make sure to check out the end because we're going to be connecting all the dots together to actually make you understand how each one is going to be playing a role to make you comfortable operating independently earlier. Phase 1. Foundational knowledge and simulation. Before ever lifting a real scalpel, the learning process is focused on mastering the fundamentals. And how do you do that? Well, it's really important to read and prepare by understanding the anatomy and pathology. This is the bedrock. You must know the normal anatomy intimately and understand how different disease states and pathology alter that anatomy. Reading in preparation for every scheduled case is a must. Every step should be reviewed of the operation, potential complications, and alternative techniques. The goal is to perform the entire surgery mentally before you step in the operating room. Another thing that you may consider is actually simulation and practice. What do I mean by this one? Many programs utilize simulation centers to develop basic skills. This includes practice tying knots, which we have in this video, and instrument handling and laparoscopic skills on trainer boxes or virtual reality simulators. Other things I do explain in other videos include how to dissect, how to do anastomosis as well, which you could probably check out. This stage is about achieving muscle memory for technical tasks outside the patient care. Almost 98% of people watching this aren't subscribed. If you're a medical student or resident who wants to think more clearly, prepare more efficiently, and perform better under pressure, this channel is built for you. Click the like and subscribe button and let's keep on going. Phase 2. Observation and assisted performance. As a junior resident, your role is to immerse yourself in the operating room environment, transitioning from watching to actively participating. You start with observation. Study the rhythm and efficiency of the experienced surgeon. Pay attention not just to their technical movements, but to their flow, communication with the scrub tech, and anticipation of the next steps. Then you progress with scrubbing and assisting. Your hands-on learning starts with assisting. This means retraction, managing exposure. The goal here is to learn how to provide exposure, how to hold tissue and provide the surgeon with a perfect view of the operative field. Great assisting is the first step to becoming a great surgeon. Why? Because when you're the surgeon, you need to know what to tell your assist to provide the same exposure that you're giving the surgeon currently. If you don't develop the skill, you're not going to be able to operate. The next one is going to be segmented learning. So you started from observation, scrubbing and assisting. Now you're doing segmental learning. And initially, you will be taught to perform small, lower segments of a larger operation, such as port placement, dissection, or final closure. This builds confidence and competence in isolated steps. Example, when I do a cholecystectomy laparoscopic and I have a junior resident, the most important thing that they should understand is, number one, is how to drive the camera. Then they would be focusing that said camera and anticipating where the movements of dissection are, followed by port placement and retraction and exposure. Once they've been seeing a couple of the cases and they understand the flow, then we start moving them up to removing the gallbladder from the cystic plate. Third one, progressive autonomy. This stage is primarily driven by your senior residency years, but make sure that doesn't limit you because you could actually progress a lot faster if you prepare more. This is where you shift from an assistant to the primary operator under supervision. The see one, do one, teach one principle, while traditional, This principle is now more accurately thought as C1, simulate many, do many under supervision, and teach one. Graduated responsibility is then actually important because you will be given more complex and critical steps of the procedure. For example, instead of just port placement as we talked about, you may do the entire dissection for cholecystectomy or an appendectomy. You have to prioritize safety and judgment. The most important skill here learned is surgical judgment. This means knowing when to be aggressive, when to change the plan, and critically ask for help. A good surgeon knows their limits and prioritizes the patient's safety above their desired autonomy. And that is something that is of paramount importance. So now you've progressed and now you're able to operate under supervision. And we're talking about from simple cases to moderate to difficult cases. Your autonomy is probably more with simple cases, and there's more coaching and feedback on difficult cases. But as you advance more, other things that you have to consider are actionable insights. The path to mastering surgery is deliberate and repetitive. You are building technical skills on a foundation of scientific knowledge. When you encounter a challenging case or complication, use it as a learning opportunity. Ask yourself, what went wrong? What would I do differently next time? And what would my attending surgeon do? That constant, honest self-assessment is how you truly learn how to operate. So let's put everything back together. Learning surgery starts with the basics: surgical preparation, positioning, making sure you check all the settings, placing the monitors, and ensuring instruments and materials are completed and understanding details. Because this is part of the work that is super important and sometimes actually neglected. Followed by preparing for the procedure. Understanding the indication, the risk, the complications, and the pathology with alternative treatments is something that is important when you discuss this with patients. Study the anatomy. Review the variations in anatomy because you may encounter them. Identify reference structures. What do I mean? Anatomy is based on relationship of structures. Utilizing references on non-mobile structures provides orientation to help guide dissection. Know the steps of the procedure. Learn how to expose, and this is retraction, positioning, which provides visualization. For MIS surgery, this actually includes port placement. As we progress, learn how to dissect effectively. Retract to expose, and cut to allow energy to divide structures under tension. Understand limits and extent of dissection and goals of each step to the procedure. Suturing, very important. Proper technique. Develop patterns. When you actually develop patterns such as where you grab the needle, where you take your first bite, how do you actually replace your needle, what do you do with the tail, how long of a tail do you leave, when you're tying knots, what type of loops are you doing? These are all things that when repeated becomes automatic and becomes faster and more constant. Doing it over and over the same time, doing it properly, is very important to achieve perfection. Do it in sequential repetitive steps which are purposeful to allow improved efficiency. And finally, review your performance, monitor your outcomes, keep an eye on your technique, and look at your times. If you guys liked the video, please click the like and subscribe button and type in the comments in the chat. Ask the questions. What are your thoughts about these steps in achieving proficiency in operating? Are there things we missed? Are there things that you're going to add? And where are you currently in your training? I'd love to hear it. And check out the other videos that you have, and I'll see you guys next time.